All right, webinar has started. Go.
Hello and good morning from University of South Florida, Tampa. It is my pleasure to be the host of this webinar. I am Dr. Amber Mahmood and I'm an associate professor at the College of Public Health. And I also lead the concentration for global disaster management, humanitarian relief, and homeland security at the College of Public Health, University of South Florida. It is a great pleasure for all of us to welcome Dr. Hediye Seval Akgu in today's webinar, who is a professor of public health at Baskent University School of Medicine in Turkey and an adjunct professor at the University of North Carolina-Pembroke and the Global Institute of Public Health in Trivandrum, Kerala, India. She has over 35 years of experience in data management, statistical analysis, quality, and accreditation in healthcare, patient safety, and epidemiological studies. Dr. Seval serves as the Chief Quality Officer at the Baskent University for 10 hospitals and 16 hemodialysis centers. She has a wide scope of research interests, including public health and migrant health, and is committed to a comprehensive and holistic approach to health issues. Additionally, Dr. Seval serves as an advisor to many international organizations in healthcare reform, quality in healthcare, accreditation in health and higher education, and has delivered hundreds of workshops and seminars to multiple health professional groups around the world. Dr. Seval has also been working with many groups in the aftermath of the earthquake that devastated Southeast Turkey on February 6, 2023, and will update us on the recovery efforts right now. So I'll give the mic to Dr. Seval now, and very, very keen to hear what she has to tell us today.
Okay, Dr. Mahmoud, thank you very much for this excellent introduction. It is my great pleasure and honor to be together with you and to share our experiences during the devastating earthquake in southeastern Turkey. Can you see the slides? Is there any problem?
Just before we start, can I mention it to the audience that this session is being recorded, and if you have any questions, you can type those questions in the chat box, and we'll get back to you. Thank you.
Okay, thank you very much again. Good morning to everybody. As I already said, it is great pleasure and honor for me to be together with you today. Here is in the afternoon, and many greetings from the earthquake area. And by coincidence, today I'm in the earthquake area in one of the city called Adana, which is at the earthquake area, located in the earthquake area. Greetings, all of you from here. And I will share with you the public health consequences of devastating earthquake in southeastern Turkey. Okay. During my presentation, I will briefly talk about the magnitude of the problem. And then after I will move to government and also international organization response to the earthquake. I'm going to talk not focusing on healthcare, but I will also touch all the government and international organization response to search and rescue operation, immediate life-saving response, essential services such as education, the other medical hospitals or other educational facilities, disabilities, refugees, especially in this area. We have around 2 million refugees. I will talk also about the consequences of this earthquake on food security and emergency livelihoods, its consequences on protection and education, sanitation and hygiene, shelter and essential items, healthcare, and then after discussing about the magnitude of the problem, I will move to next step. I will talk what we did so far, but what people need now, and I will give some recommendation for an effective disaster management. And I will share with you many pictures from the earthquake area. I had the opportunity to visit the earthquake area twice. I mean, the earthquake area is really a very big area. Of course, I could not visit all the area, but it's very dramatic situation, the places that I visited. So as we all know that different consequences of disasters have been known well, and they can encompass the death of so many people. In addition, great economic and political impacts that we will see the political impacts also in Turkey, because we have very soon an election on May 14th, so we will see the political impacts. We have great economic impacts already. I will also mention about that one. There are many impacts on social and psychological side, destruction of infrastructure, generally the disruption of social life in societies. So among all this, the consequences that may harm the people's health and lives are vital. So I will much focus on that issue. And as a healthcare professional and public health person, I will talk more about the consequences of healthcare, because a significant number of people need proper healthcare following a disaster. And the disasters reduce the physical health of survivors with injuries, intensifying chronic diseases, and decreasing access to the health services. This devastating earthquake of 7.8 on the Richter scale hit southeastern part of Turkey. At the beginning of my slide, maybe you already saw the map of Turkey. And you see the earthquake area, but I will show you later. It was the earthquakes, let's say series of earthquakes, because it was not only once, the series of earthquakes was in the southeastern part of Turkey in the early hours of 6 February. And the epicenter is in the district of Kahramanmaraş province. The earthquake affected also the neighboring provinces. For instance, now I'm in Adana. I'm joining this webinar from Adana. So it affected around 11 provinces in that area, where about 14 million people reside, including 1.8 million Syrian refugees. So the initial earthquake was followed by over 3,100 aftershocks, including a 7.6 magnitude earthquake that hit again another district of that city, Kahramanmaraş, causing further severe damage and destruction of damaged buildings. According to all this data is from Turkish Disaster and Emergency Management Presidency, we call AFAD. So I already mentioned you that we had series of earthquakes, around 3,000 aftershocks, and we had 2 very big ones. And you see the map again, and you see the circle, the earthquake area was there, and it is very near the Syrian border. Of course, in Syria also affected, not only Syria, the other neighbor countries also affected. But I'm not going to talk about the consequences or the impacts of this earthquake in Syria. I will focus on what happened, because the center was in Turkey, and really affected around 15 million people. And it lasted too long. I mean, 1.5 minutes each one, which is really so big for earthquakes. This is really a very big disaster. And you see one picture, the one of the building, you see, it also shows how the earthquake was very big. In these pictures also, I took all these pictures from the earthquake area, and still the life is very, very difficult in that area. Almost more than 2 months passed, but the progress was not so promising. To be honest, I should admit with you that the progress was not so promising. I mean, everybody is trying, the government also trying, but it is really very, very big disaster. I don't think that any country, or almost very rich and very developed countries, also could not solve all the problems faced during the earthquake, and after the impact, aftermath of the earthquake, impact of earthquake, not so easy. You see the provinces affected, again in the map. So these earthquakes really the largest to Turkey in the last century, and the most significant to strike the country's southeast region in hundreds of years. Actually, yes, Turkey is, under the risk of earthquake. I mean, in many different parts of Turkey, we have that risk, but we have never seen such a big earthquake like this before. We had three, indeed, to impact the country. One was near to Istanbul. It was, the magnitude was 7.6, 1999. I mean, I was also that time chief medical officer of a hospital in Ankara, and we received a lot of patients. In Istanbul also, there was one hospital, a lot of patients, and the impact of consequences of that earthquake was also dramatic, and killed around 20,000 people and injured nearly 50,000 people. And then one, Erzincan, it's the eastern part of Turkey. I mean, I heard, but fortunately, I not experienced that one. The magnitude was also 7.8 and killing at least 33,000 people. And, Turkey, Anatolia, so in the north part of Anatolia also in 16th century, 1668, the most powerful recorded earthquake in Turkey was occurred, and the magnitude was around 8 Richter scale. So you see again some dramatic pictures from the earthquake area. And this earthquake, in this very dramatic series of earthquake, more than 58, let's say 60,000 people in Turkey had lost their lives. And we could not reach many of the deceased bodies. We could not, find out many deaths actually. So according to us, at least 100,000 or more than 100,000 people had lost their lives, and tens of thousands were injured. Okay. The earthquake struck while trapped inside buildings as they collapsed, and more than 100,000 people were injured. All this data is from that institute. And actually, as I already mentioned you, that we expect more deaths indeed, and the number of deaths is expected to continue. I don't know, maybe it's impossible actually to find out all those deaths, because almost 2 months passed. So because many people's, lost, maybe there was no deceased body, but there was no telephone signals, or there was no evidences that those people are still living. So again, you see some pictures, and sad thing is the earthquake hit communities at the peak of winter, and leaving hundreds of thousands of people, including small children and the elderly, without access to shelter, food, water, heaters, and medical care in freezing cold temperature. So most of the people maybe died because of all these reasons. And many buildings have been destroyed and damaged, and thousands of people have sought refuge in makeshift shelters across Turkey, including school, mosque, and other temporary shelters allocated by the government according to care. And more than 196,000 people had been evacuated from quake-hit areas, and hard weather, including flooding, storms. After the earthquake also, there was flooding, there were many storms still. Today, for instance, in Adana, there was, really very heavy rainy, not flooding yet, but in this area, I don't know what is going on. Last 2-3 months, a lot of disaster is happening. So these are added to the challenges faced by families ravaged by the earthquake, as well as the ability of government and humanitarian agencies to respond. Yes, so this is the magnitude of problem. With the numbers, I would like to share with the many figures from that area to you in order to show how big the disaster was. So in this part, I will mention about, again, based on data from different institutes, evidence-based. I mean, I already mentioned that I also visited, and many of my friends also visited, and according to according to us, let's say, the consequences and the impact of all these earthquakes is much bigger than all the figures that I'm sharing. But these are the figures that government already announced and shared with us, okay? And the humanitarian agencies also share with us. So if we look at the government response and international solidarity, maybe Dr. Mahmoud later mentioned about the disaster healthcare management, but very briefly, let me remind you that the disaster healthcare management is a systematic process, administrative, organizational, and operational decision-making skill and capacities that deals with the challenges of planning in order to improve and reduce the healthcare consequences of natural disaster. And usually in the natural disaster, there are three basic criteria. First, there is serious harm, so we try to reduce those serious harm. And second, there must be expectation that someone can do something to prevent reduce harm. And the third criteria, time pressure. Okay, so we should be in a hurry, and we should, provide all our healthcare services on time. However, the healthcare services will be different in this situation. Most of them damaged, destroyed. In any case, disaster needs to be followed by quick decision. That's why government of Turkey during the earthquake set up strategic objective. The first objective is provide timely life-saving activities in a multi-sectoral way. Emphasize and assisted communities to survive the winter in support of government-led relief effort. And the second strategy is to support the rapid delivery and resumption of essential services in earthquake-affected areas, okay? Now, if we go through one by one all the issues, the first one, of course, the search and rescue operation. The initial humanitarian response took place in three main phases, which overlap in practice, depending on how the situation and relief efforts evolve. Search and rescue operations, immediately following the earthquakes, government efforts there, international effort there, and focus first and foremost on search and rescue. This is very critical because all the people, they need immediate, support and immediate help. They are under risk of loss of life. So it's very critical time. However, I must admit that the government response was not successful at the first very important 3 days, and many lost their lives because of this. Maybe the government, they did not expect also such a big natural disaster. They did not think that the disasters were so big like that, and they were not very well organized, especially in some cities. The main city in the Syrian border, Hatay, it's a much more affected city, province than the other one. The people share with us in that area, or told us that, or told to the media, or in many places, they could not get enough support, or they could not get, enough immediate help at the first 3 days, even at the first week of the earthquakes, which is very, very important. Okay. Although, the government, announced the alarm and rapid assessments to inform immediate life-saving response, ramping up deliveries of vital relief items, including food, shelter, blanket, clothes, urgent support, multiple actions to prevent and address protection risk, extensive community. Yes, but I must tell you that community engagement was really very good. There was extensive community engagement. For immediate life-saving response after search and after the first one, search and rescue operation, immediate life-saving response also started, and they tried to work rapidly to expand the scale and scope of humanitarian effort, but a little late after 3 days. So maybe that it was the reason the number of deaths are so high. You see again some pictures. You see again some pictures from the earthquake area. As you see, this one of pictures from rescue activities, and this is hospital indeed. One of the tents, two tents hospital. Okay, for essential services, because everything destroyed. In 2-3 provinces there was almost nothing. Including school, hospital, other medical, maternity, and educational facilities, all have been damaged or destroyed. Only 1 in 7 family health centers remain functional, okay, according to the preliminary assessment. Over 200,000 pregnant women who need access to maternal health services were living in affected area and will have birth under the most difficult circumstances. In that area, total fertility rate is high because refugees are living, or the lifestyle in that area is different than the western part of Turkey. The total fertility rate in Turkey is around 1.8, but in that area more than 3. So a lot of pregnant women also needed help. Okay, you see again, some examples from the earthquake area. This one is school. One is hospital again, or family center, let's say. Okay, you see again some pictures. This is also again one health center. This is for examples from essential services for children, school. You see. So this is for essential services such as schools, such as hospitals, and when we look at the disabilities. Many families have been separated with hundreds of children, orphan. I don't remember now the last figure for the orphan or unable to be reunited with the parents, the number of children, but it's really too high. So I cannot even watch it. It's very sad, very dramatic. Unfortunately, the situation not so good related to that one. Prior to earthquakes, an estimated 7.9% of females and 5.9% of males in Turkey were living with disabilities. However, this figure expected and to rise significantly in the aftermath of disaster. And according to me, it could be closer to the global average of 15%, which is very high. Just a few days ago, our great president just announced 85,000 people became disabled after this earthquake. Some 8% of 3.3 million households living in 10 provinces where a state of emergency had been declared are female-headed households with at least 1 child, while 7% of population in the 10 affected provinces is over 65 or above, and 55% of elderly population is women. And Turkey is a young, young generation is higher than, not like the other European countries. The percentage of people age over 65 is around 8%. And in that area, already mentioned you that, the total fertility rate is high, and the young generation, refugees are there, but still, as you see, the elderly population also high in that area. Yes, refugee, in my last visit to your university before COVID-19 pandemic, we discussed about the refugee health and the migrant health. Turkey hosts the largest refugee population in the world, And in the 11 provinces impacted by the earthquakes, there live more than 1.8 million refugees. For instance, in one of the provinces, in the earthquake area, 1 out of every 2 people is a refugee, So really a lot of refugees living in that area. Actually, in all over Turkey, we have around 15 million refugees right now. So with this economy, with these earthquakes, I don't know what will happen in the near future of Turkey. So considering the massive needs caused by earthquakes and the government's call for international assistance, a flash appeal had been issued to galvanize all resources and enable humanitarian organizations to rapidly ramp up their operations in earthquake-affected area in support of government-led response. So government Turkey issued a level 4 alarm calling for international assistance. Okay. Yes, and a lot of efforts spent indeed. I mean, I cannot say that, yes, maybe they could not, immediately, especially in some provinces, the government's response was not so immediate, especially in the first 3 days, but under the government leadership, again, I will give you some big figures, and you will see that how also we spent a lot of efforts, as you see, 250,000 search and rescue workers and more than 13,000 vehicles, including excavators, tractors, cranes, bulldozers, everything, deployed to affected areas, and more than 5,000 sorties had been undertaken with many helicopters, many aircraft, ships are there. More than 8,300 international search and rescue personnel, supported by nearly 260 search dogs from 169 United Nations classified and other international urban search and rescue teams deployed to Turkey. Food security and emergency livelihoods also very important. That area was agriculture area indeed. It was also one of the main mistakes. And before, there was no building in that agriculture area because also there was risk for earthquake in that area. So the government never allowed to be able to construct any buildings in that area, but this government, changed all the rules and regulation, and they allowed to people, they opened that area for construction, and many buildings constructed. Outside, all the buildings looks very modern, big buildings, but unfortunately, we saw that they broke all the rules and regulation, and at that end, many people died because of that. Okay. So food security and emergency, and there were many livelihoods also in that area. So humanitarian partners distributed family food baskets, hot meal, as well as delivering food to support municipalities in that area. If needed, cash and vouchers were also provided. Okay, so for food security and emergency livelihoods, also there are many activities there. Protection and education, very important. Already mentioned that a lot of children there, a lot of women there. So, and their psychological support is very, very important. I don't know, from now on, indeed, 2 months past. So I'm sure that a lot of studies, a lot of psychologists will be in that area in order to provide psychological support to this group, okay? Partners also support the service providers to prevent and respond to violence against women and children. Mentioned that a lot of refugees there and all kind of people there. So there's no security. And I mean, yes, if only Turkish people, maybe it could be much more easy to control everything in that area, but many different people from different area, many temporary settlement areas, so on. So there was also violence against women and children, and the Ministry of Family and Social Services worked hard in the evacuation of children to safe spaces. Water and sanitation, hygiene, also government, humanitarian, but I generalize as humanitarian partners, mostly government-led organization and international organization, everybody included in that definition. So they provided many kits, hygiene kits, conducted hygiene promotion campaigns while assessing water and hygiene services to identify further support need. Shelter and essential items really important. So presence for migration management, coordinating all activities with relevant organization. So provided tents, warm winter clothing, blankets, mattresses, kitchen sets for thousands of impacted people. UNHCR was also there. Actually, UNHCR was in that area for many years for Syrian refugees. They also distributed all those essential items and shelters. I told you that community engagement, very, very important. Dr. Mahmoud, I'm sure that mentioned about the importance of this coordination and community engagement for an effective natural disaster management. So community engagement, we disseminate information and messages to communities in multiple languages because Kurdish people there, many Syrian people there. So we use multiple languages and seeking feedback on the response also. For coordination under the authority of government organizations such as EFAT and such as the municipality heads or such as a mayor of the cities with the help of the international organizations. So they try to coordinate all the activities. You see again, this is one again family center and another tents for settlement. Surveillance of injuries at medical treatment sites also important. We need to, for all the figures that I'm sharing with you, very important in order to understand our current situation and how we can move forward. So we organize, especially the designated GPs, organize surveillance on injuries, collect data, see that the data are tabulated, reported to disaster response official. From there, again, efforts, I can share with you that up to April, I don't have figures last 2-3 weeks, there are around 6 million individual applications to the hospital. Total of 150,000 surgeries were performed. 53,000 of the major surgical interventions. The number of earthquake victims and trauma code applicants is 390,000. 15,000 surgeries performed on these patients. Approximately around 200 million drugs and consumables were sent to the warehouses. Many medical devices were shipped. 102 demolition, 27 medium, 122 detection were made, including severe damage. A lot of patients were treated in the field hospital. We carried, for instance, here in our hospital, the network I'm working as a chief quality officer at 4 hospitals in this area. So many patients, and these are tertiary hospitals, so crash syndromes, many traumatic patients, carried from the earthquake area to the hospitals in this area, because in the earthquake area, the hospitals also destroyed, very few hospitals, left. And a lot of Turkish lira spent to repair and, construct all these healthcare facilities, okay? Yes. And many people also injured. I already mentioned you. Most of them already mentioned you that carried by aircraft, by air. Many villages visited for health screening. A lot of healthcare professionals, appointed or moved from Western and the other parts of Turkey. Around 30,000 healthcare professionals, sent or appointed to that area by Ministry of Health. And you see many ambulances there, many teams were there. And currently 1 out of every 10 personnel of Ministry of Health work in the earthquake zone. You see again some example. So in addition to increasing morbidity, mortality, disability, as you see, severe disruption of health system, many damages of health facilities. So in the near future, I think we have a lot of, or we should spend a lot of efforts on this issue. We mentioned about all these figures, more figures, inpatient treatment, oral dental health services, a lot of, different figures, different area. This is one of the, hospital. The hospital is there, the hospital building, but unfortunately, again, damage. So the services, provided in the tents just in front of the hospital. So, also the humanitarian response has reached the scale and scope required to save lives and alleviate suffering, and humanitarian partners try supporting development and reconstruction actors and promoting resilience building and community-led recovery efforts, the restoration of livelihoods, community infrastructure, basic social services, and the transition of longer-term recovery and reconstruction activities are some of the examples to support people to resume their life. This is the current situation, but what do people need now? Still, there is urgent need for life-saving shelter assistance. There's not enough, tents, or there's not enough temporary settlement area. So immediate shelter assistance and winterization items ensure that affected households were protected from extreme weather conditions. Food, non-food items, kit also needed in that area, because food industry was hit hard by the earthquakes, including the milling, dairy, meat and bakery sector, as well as primary processing. Rural area initial information points to measure disruption of crop, livestock production capacity, including loss of animals, poultry, ruminants, and damage to shelter, greenhouses, irrigation facilities. So after COVID-19 and after the war in Ukraine, we were also affected all this pandemic period, and also the war, which is very close to Turkey. Russia is our neighbor and Ukraine is a neighbor. So we also affected, already had increased the price of food and reduced the availability of commodities. For the time being, the consumer price inflation in Turkey reached over 100% in November, and now it is much more. Okay, reaching under 50%. So it's really this part also very important. Prices expected to rise further as national food systems are severely disrupted due to damaged infrastructure and access constraints. So estimated of 5 million people, including 1.5 million children and more than 1.8 million refugees and migrants, who are expected to be affected by insufficient immediate access to enough and safe food. Okay, so as a consequence, we are expecting moderate to severe acute malnutrition, which we are not seeing. We don't see severe acute malnutrition in Turkey for some years. I have also a PhD in nutrition, and it's one of my main area. But it seems that pregnant, lactating women, children, elderly people, and people with disabilities are under the risk of malnutrition, or let's say particular risk. And trauma-related deaths, there were many. Mental health, psychological support needs another. The increased risk of infectious disease, including cholera and other waterborne diseases. Up to now, we did not see almost 2.5 months past. We did not see, but who never knows, because crowded area, they are living now in the poor shelter, the water sanitation. Already we discussed that there are problems with the sanitation, water hygiene, and overcrowded areas. So we could see this kind of infectious diseases. Okay. So in the coming months, increasing levels of malnutrition, incidence of violence against women, girls, and other at-risk individuals, interruption of essential medical services due to an overhand health system, and the damaged infrastructure is awaiting us. Okay, Women, for instance, I listed some. I'm not going to, share all these, issues with you, but it is obvious that, and we already discussed non-food items, including dignity kits, hygiene material, soap, clothes, psychological support, access to safe segregated wash facilities, access to sexual and reproductive health services. Many pregnant women was there, already gave you the number, access to information available to humanitarian services. And, as a vulnerable group, women and children need more than that. And protection, most of them are deeply traumatized, especially refugees and vulnerable group. Many children have endure intense trauma, and hundreds have been separated from or lost their families and loved ones. Multiple child protection concerns have emerged, including evacuation, support for unaccompanied and separated children, prevention of trafficking, tracking the reallocation of children in safe spaces, okay, and violence against women, girls, individuals, and other situations vulnerable to also rises. So urgent actions are required, actually, to enhance child protection, including national capacities for identification and provision of individual care to unaccompanied and separated children, prevention of violence against children, inclusion of children with disabilities, provision of alternative care, support to vulnerable families. The ministry and the migrant centers are trying a lot to find out the parents and caregivers of the children, and trying a lot to provision of services to them, and provision of, for instance, integrated response to child-friendly spaces, but still a lot of efforts needed in this area. Temporary settlement support, I already mentioned on this issue that, population need homes, most of the buildings destroyed. So the population made homeless have an urgent need for shelter and food, also drinking water, clothing, sanitation, so on. Because a lot of buildings, around 50,000 buildings have been destroyed or damaged. Many people have been evacuated, but still some of them are under still earth, under the buildings. Water, sanitation, hygiene, also the municipalities should work hard on this issue. Again, government should work hard on this issue, because the earthquakes damage critical water, sanitation, hygiene, infrastructure, and limited communities' access to safe water, sanitation, and hygiene services, okay? So, yes, the earthquakes, a series of earthquakes that struck Turkey on 6 February were amongst the most powerful to hit the country since 1939 and deadliest in more than 8 years. Yes, I already shared with you that many things, many efforts have been spent, but still many public buildings destroyed, are unusable. Yes, still we, search and rescue phase not completed yet, and in a very local area, it still continue. But as soon as possible, I think the government in some areas started rebuilding and recovery of people and communities impacted by the earthquakes. You see again some pictures. As a conclusion, I will give some recommendation. Actually, lessons learned, let's say, what we can do with all the lessons learned after this devastating, very dramatic earthquakes. We lived in the southeastern part of Turkey. Although we can neither prevent earthquakes, these are natural disasters, nor set of small ones to prevent big ones, we should take earthquakes into consideration before undertaking activities known to precipitate earthquakes. First of all, safer construction. We saw that in this devastating disaster, preventing structural collapse is the most effective approach to reducing earthquake-related fatalities and serious injuries. So engineering interventions very important. Already mentioned with that, the government, allowed to break the rules and regulations, and they allow to construct buildings and area which were under risk of earthquake. So while while constructing new buildings, we should consider all these issues. And while constructing new buildings, we should follow the modern methods for constructing the engineering interventions. Okay, for instance, seismic security will allow buildings to withstand earthquakes with little or no damage, like Japan. They are under risk. Or in the States, I found two examples in some of your area also under the risk of earthquake. So the San Francisco Bay Area from 1989 Loma Prieta earthquake, and the Los Angeles area from 1994 North Ridge earthquake were kept much lower than would have occurred in a less well-prepared region. So we need to, develop or we need to strictly follow all rules and regulation, and we need to maybe develop new methods in order to reduce, in order to improve the constructive engineering issues, and in order to reduce the number of deaths. Unfortunately, for instance, with our government, just to get some more votes, zoning amnesty we call. So every 5 years, the people who broke the rules while constructing the buildings, every 5 years government, allowed them that, okay, you don't need to pay any punishment, because, to get more votes. There's zoning amnesties are all accepted. So we should be careful on these issues. For instance, most of the deaths occur because of the suffocation from dust inhalation. This is a significant factor in the deaths of many people. Okay, so we need to develop using methods of reducing dust release during a building collapse could perhaps prevent many deaths. Non-structural measures also important. We are doing many drills, but it seems that all drills were on the paper. I don't know. In the hospitals also, it is one of our main program, and we are so keen. They're making a lot of drills. But unfortunately, actually did very big, yes, the 7.8, but it seems that we couldn't learn enough lessons from the previous earthquakes. So structural stability and robustness to violent shaking of all these elements should be reviewed. Although often beyond the purview of building costs, heavy furniture, glass cabinets, appliances, and objects placed where they could fall or be thrown about should be firmly secured to prevent them from striking people in the event of earthquake, and special precautions must be taken with source of flame or electric filaments and boilers, heaters, space heaters, so on. Earthquake drills are very important, okay? So I think we need to repeat this earthquake drills more and more in order to create awareness among the public, okay? Building occupants usually have a few seconds to react before, so the shaking reaches maximum intensity, raising the possibility of taking evasive action to escape injury. So by conducting epidemiological studies of the location of injured and non-injured people, we can determine which behaviors are truly most likely to reduce the risk of injury or deaths. So surveillance of all these activities very important in order to understand the current situation and to maximize trapped victims' chances of survival. Search and rescue teams must respond rapidly after a building collapse. Knowledge of collapse condition also have set rescue priorities. For instance, these are some examples for surveillance. Medical treatment, we mentioned, we talk about that immediate life supporting first aid, advanced trauma life support, restorative surgery, field anesthesia, restorative engineering, and intensive care. All these, these are the greatest demand occurs within the first 24 hours. As a public health person, I think detailed follow-up epidemiology to collect more extensive data, very important concerning the circumstances of entrapping. A lack of such data has made planning search and rescue actions providing proper medical care and requesting the appropriate outside aid more difficult. So, for an effective health emergency disaster and risk management program, policies, strategies, legislation, not on the paper, for implementation also, very good planning and coordination, enough human resources, enough financial resources to create awareness, to pass all the information, to manage the knowledge and information, identify all the risk, community engagement, ensure community engagement, and monitoring and evaluation are very, very important. Yes, disasters demand variousness as they are very different according to time, place, and their extent. And as I already shared with you, that great efforts should be made to ensure that each person receives proper care and the lives are preserved. So we need, first of all, a very well organized disaster preparedness plan. It seems that we had, and I already mentioned that every province, every institute, because we are under risk of earthquakes, so every institute indeed have a disaster preparedness plan. However, we thought that we were not so successful in the implementation. Yes, on the paper, everything is great, and in our shelves, everything is great. But however, we see that, the community also, we could not, prepare community for a disaster. Effective community participation are crucial. So joint planning and action by ministries of health and other government ministries and other international solidarity or international organization or national disaster management agency, private sector, community-based organization, and assisted by international communities, very important for a success of disaster management. So this is overall what I would like to share with you. Very difficult situation, very dramatic situation. Hopefully, in the near future, we will see how we will, solve all the problems, and we will, combat all the problems and all the impact, public health consequences of this devastating earthquake. Thank you very much for your attention. Thanks for listening to me. If there are any questions, yeah, I'm here.
Thank you, Dr. Seval. I mean, I'm still trying to wrap my head around the breadth of information that you have just provided. It was a lot to absorb, and I think all of the participants share the sentiment with me. I don't see any question answers in the question box, but I would welcome anybody who has a question, a burning question in next 3-4 minutes to raise their hands or put their question in the chat box. Meanwhile, I have a question, and it's just fascinating that two questions. First, Turkey is a very active, Turkey is situated in a very active earthquake zone. And like you said, that there were so many aftershocks and significant aftershocks, including a major earthquake after the main index earthquake. So how does this affect the search and rescue operations in the areas that are most affected? What do you guys do in terms of you wait for for the aftershocks to settle down, or you start the search and rescue and deal when the aftershocks come as they go?
Yeah, I already mentioned you that all the people living in that area complained that the search and rescue operation did not start immediately. So the immediate action was not so active during the first 3 days. Maybe it was one of the reasons, because there were a lot of aftershocks. Maybe we are complaining and we are accusing the government that they did not, they did not intervene, or they did not act immediately immediately, but there were many aftershocks, as you already mentioned. So it was one of the reason maybe, but in any case, they should immediately act, and they should immediately start on search and rescue activities in that area. Most of the people died because it was late, okay? And the weather was also very cold. So the people waited in that collapsed, damaged buildings, sometimes more than 3 days, 4 days, 5 days. It's unbelievable. You could not, I could not imagine myself. I don't know. I'm sure everybody was at the same station like me. I could not imagine myself to stay in a place, and waiting somebody to rescue me, to save my life. I said very dramatic. So yes, there were many aftershocks, more than 3,000 aftershocks, and there were series of earthquakes. Not aftershocks. The Richter scale 7.8, 7.9. Yeah. And those were big earthquakes. So not aftershocks. Those were, but in any case, the rescue and search function, all the activities should start immediately. Should be started immediately. And we were late, and because of that, many people die. Okay, so this is important. Maybe the reason why the authorities, waited for a period especially for some provinces, because there were many aftershocks, and the series of earthquakes still continued. Maybe it was the reason they could not reach. And by the way, all the ways, the airport in one of the cities still not working, damage also. They could not also reach, we could not reach also the people there, although the ways also damaged. It was another reason. It was a big area. It was not a small area. It was as easy, to reach all the people. I'm talking about, very big area, 11 different provinces. So, yeah, you are right. Very important, but that's rescue and search, very, very important. First step.
So before we go, I think I have a question from Jesse, and Jesse wants to ask: would you consider the affected area to be still in a humanitarian phase, or now we are like in a humanitarian crisis phase, or perhaps the recovery and reconstruction efforts have already started? So what is the phase of the crisis right now?
According to government, they started the recovery phase, but I don't think that in most of the area there's still humanitarian crisis. There's still a need for shelter. There's need for food. There's need for hygiene. So they still need more efforts. They still need great support. Because of this election, now people forget that area. Actually, everybody now very much interested on the election issues, all the discussion in the country. We forgot all the people living in that area. Very few now. Before, at the beginning, the community participation is great. The community engagement was great. A lot of support, they received a lot of support. Many people, including all of us, are my students, all are physicians. I told you that Ministry of Health also sent a lot of healthcare professionals there. One in every 10 staff working for Ministry of Health, sent to that area. But last 1 month, this is my personal actually. Also, you can also hear this from many people living in Turkey. Because of this election discussion, everybody forget the earthquake area, much more focusing on those issues. So still there's crisis there. Yes, recovery started. It takes time, Dr. Mahmoud. It is not so easy. It was a very big disaster. So it takes time, and Turkish economy is not doing well. I even share with you the inflation rate. So with this economy, we will see what will be happen. Everybody is now waiting May 14. After May 14, we will see what will be happen. What kind of actions will be taken? We will see what will be happen. But for the time being, yeah, the party leading the country now, including the president, telling that a lot of recovery activities there. We constructed this. We started this big construction. We did this. We did this. We did this. But I don't know, I did not visit all the area, but my students who are working in Ministry of Health and who are already working in that area, that in some provinces still, no touch. So we will see.
I have another question from Elizabeth. And Elizabeth is asking, do you see a large number of individuals leaving the area into other parts of Turkey, or an increase of Syrian refugees that are coming out of the areas impacted in Syria into Turkey?
We have a lot of refugees. I already mentioned that. Could you please repeat the question? Syrian refugees for what?
So she is asking, do you see a large number of individuals leaving the area, the affected area, into other parts of Turkey, or there is an increase of Syrian refugees that are coming out of these areas? Like, the Syrian part was also damaged. So do you see Syria?
Not like Turkey. I mean, it was not so big like Turkey.
Okay.
It was not so big like Turkey. Yes, there are 1.8 million Syrian refugees in that area.
Mm-hmm.
I think the number of deaths around 5,000 or 6,000. It's not so big. I mean, maybe we could not identify. We could not identify. I don't know. Maybe because they did not have any identity card, so on. Maybe the number of deaths among refugees much more than that. I don't know exactly. But the official figure, already the government announced that around 7,000 Syrian refugees died because of earthquake. Yes, a lot of refugees moved. In Turkey, in Istanbul, I'm so sorry, but I could not hear even one Turkish word in my last visit. A lot of refugees there. So Turkish people now, we are going to become minority very soon, Dr. Mahmoud. It looks like that. So they moved, of course, from the refugee area. That area was most populated one. They moved to all the states because there's no control, Not only, Syrian refugees, but Afghan refugees also we have a lot. So they moved, of course, but they affect, that's true, because 1.8 million refugees there, and their living condition is not so good. Actually, that area is not a very rich area, by the way. There are discrepancies in Turkey. Everybody knows this, between the regions. There are big discrepancies, and in that area, that southeastern part, eastern part, not when we look at the GDP is lower than the national average. So that's Turkish people also not so rich. I mean, almost equal, let's say. But Syrian refugees also, unfortunately, they also, affected. Many died. And we are not making any discrimination, by the way. Syrian refugees much more lucky than Turkish people, because all health costs cover, because they are refugees, there's an agreement, they are covering all the health costs, without any charge. Yeah. Government is covering all their health costs. And they are giving some monthly fee for their basic, needs. So they are much more luckier than Turkish people living in that area. But everybody affected. This is big disaster. In my talk 2 years ago, I talked about the Syrian refugees, and I talked all the Turkish government, efforts for Syrian refugees. But a lot of Syrian. We have 15 million refugees right now in the country.
It is a big number, and
Yes.
Unfortunately, we are seeing these mass movements across the world. This is an unprecedented time.
Yes,
in global health and humanitarian health. I wish you all the best, Dr.
Thank you very much.
This is, I wish we were talking in less stressful times, and it was not such. This is fascinating, no doubt about that, but it's also heartbreaking to see that level of catastrophic, disaster, and the lives that are lost, and the lives that will be affected for a very long time.
Exactly. Yes.
Sometimes it takes a natural disaster to change the political leadership in many places.
We will see.
So good luck for
In
the
20 days. You know, actually, it is right. And the previous one, I mentioned that 1999, we had another big one near to Istanbul. And this government, you know, got all the votes just after that one and leading the country for 21 years. And, you know, the political leadership changed because of that big natural disaster. And now again, this is destiny, or I don't know. We will see what will happen. So another big disaster, and we will see how the political leaders will, you know, how to say, act, or how the things change in the country. Hopefully, all will be good.
hopefully, as we say, inshallah.
Yes.
Thank you so much for your time.
It is my great pleasure. Thank you very much for giving me this opportunity.
And thank you so much for all the participants who were here, and we will have this, we have recorded this presentation, and hopefully we will share it soon. And thank you, Dr. Seval again, and my panelist for assisting me, and hope to see you soon in a different time and a different setting.
Thank you very much. Hope to see you in beautiful Turkey soon. It's beautiful. Turkey is a beautiful country. Okay, we have earthquakes, but still the landscape is beautiful. So welcome whenever you want.
Absolutely.
Thank you very much. Thank you.
Thank you.